Well, as we've been hearing, good sanitation and hygiene is critical in reducing child mortality. And so the fund will work closely with UNICEF, the United Nations lead agency on children. Its executive director, Henrietta Fore, says the COVID-19 pandemic has exposed vulnerabilities in sanitation and hygiene systems.
We have 4.2 billion people in the world who do not have access to sanitation services, and we have over 3 billion who do not have access to hand washing and soap. And with that, you realize that it's very difficult to overcome pandemics like a COVID if you do not have sanitation, water, hygiene services, and information. And Zeinab, one of the other things that comes immediately to mind is it's not just people in their households that are having problems, it's schools, it's hospitals, it's community health clinics, and it's most difficult in the poorest countries and in the poorest communities within those countries.
Henrietta Fore, you've described sanitation and hygiene as great equalisers for children. What exactly do you mean by that?
Well, every society, every country is unequal. But when you look at something like sanitation, you realize that there is an inequality that most of us have not experienced and is extremely difficult, challenging for those who are in it. So, for instance, during a lockdown, how do you cope with the fact if your household does not have a toilet? This is particularly difficult for girls and women. Sanitation, hygiene, water. If we focus on it as a world, we could recover and we could allow this to be a great equalizer. If everyone had access to it in households, in their schools, in their health facilities and communities, it would make an enormous difference in our world.
We know what the problems are, we know what needs to be done, and of course there has been progress, but it's been too slow. So just give us one or two examples of what are game changers that would really accelerate access to sanitation and hygiene.
So Zeinab, you're right, we're moving too slowly. We need accelerators. And the Secretary General came out with a framework that we think could work. So it begins with governance, political will. Good sanitation has to be a public good. Governments have to own the fact that sanitation is their problem to solve and that they have ways to solve it. So number one is that political leadership. There's just nothing that takes over that. The second is financing. Many governments find it difficult to find room in their budgets for sanitation, for water, for hygiene services, but they just must make that role. And what's good about today's world is we have ways to blend public and private finance. And when we do so, it means they can leverage and build upon each other. And the third area, Zeinab, is innovations. This sector is one that people are now starting to turn to about how they can innovate, how they can do things differently. Toilets that do not need sewage systems, ways that you can have mobile hand washing stations, water filters, ways that you can make soap very inexpensively. But all of this is important that we put our thought and mind and attention to, because sanitation, water, hygiene, it is a basic human need and a right.
And obviously, Henrietta Fore, your agency, UNICEF, is the lead one at the United Nations on children. So what is UNICEF doing specifically to address these problems?
Well, one of the areas that we've been working very hard on is to get information out to people all over the world. So we've reached out more than 120 countries to just get information out about hygiene and how important it is for you, your family, the children in your family. And then we also have been training many healthcare workers. These frontline workers become the basics that any government or community uses to be able to keep a safe and clean environment. We've trained more than 3 million of them. We've gotten a chance of putting out personal protective equipment that allows for hygiene within it and the supplies that go with it. So whether it's water, antiseptic, soaps, it's for hospitals, it's for schools, it's for households, and it changes the world that children live in. And so these will all be new innovations for our world, and it will allow us to see more clearly where we need to focus for water and sanitation.